More questions, other questions?
Two questions. One is, what's the cost in this area? And how far off are we from it being covered by insurance?
How do insurance companies make money? Two ways. First of all, the first question, why do insurance companies exist? In one word or less. Money. That's the only reason they exist. They do not exist for your health. They do not exist to pay the doctor or the hospital. These are companies for profit. They only exist for one reason, to make money. Second question, how do they make money? They charge premiums and they deny benefits. Anytime they can deny a benefit, they've just made money. You get a nicer bonus, the shareholders get money, everybody's happy except the patients that needed the service. I don't know that it'll ever become approved. Nobody's spending any money to show that thermograms are highly effective. It's being patient-driven, person-driven, and so I don't know that that'll ever happen. Actually, there's a group, there are groups that do pay for those things, like I think Samaritan's Purse members, medical cooperatives. A lot of them will pay for thermograms after you've met your deductible as usual. And was there another component to the question?
Yes, what's the cost?
Cost. I don't know what the cost in New York is. In San Diego, it's around $250 for a breast. I think $500 for a full body. There's a dentist here in New York that actually does these and does them with thermal cameras. If you can get me my cell phone, I'll give you his name. Yeah. So I can take another question while I'm trying to look that up.
Just going back to the stem cell, I noticed that you didn't have Alzheimer's up there or dementia. Do any of the things that you talked about assist with that issue?
Alzheimer's is a very complex issue. You've got tau formation, you've got beta amyloid. It's not called type 3 diabetes for nothing. It's a progressive disease. You can, contrary to what I was taught in medical school, new brain cells grow every day, thousands of them. So the brain can regenerate, although more slowly than other organs. Our white blood cells are probably the most rapidly dividing. Liver has huge regenerative properties. The brain much less so, although I have seen patients treated with stem cells with Parkinson's that had dramatic improvement. There's no FDA indication for stem cells for Parkinson's. I have seen patients with ALS get significant improvement, and I've seen a few cases with Alzheimer's improve. All Alzheimer's isn't Alzheimer's. It's a diagnosis kind of exclusion. You see the brain shrinking, but it's a complex disease that's not caused by necessarily one thing. So it's not an easy fix. But UCLA published a study a couple of years ago, I think 2015, showing that Alzheimer's could be stopped and even reversed to some degree. Guess what the number one item was? Diet and lifestyle. Exercising your body and exercising your brain, keeping your brain active. So healthy water without chlorine fluoride, healthy food, non-GMO without chemicals or fertilizers. Exercising your brain are the number one ways to prevent Alzheimer's. And if you've got the APO4E gene, it's not the end of the world. It's called epigenetics. We can absolutely, and you've heard that here several times this weekend, we can absolutely influence the effect of genes, or whether they play or not, whether they're active, or whether they have an effect. So antioxidants, healthy foods, the right kinds of foods, and bringing healthy active stem cells. using products that we know stimulate new brain cell growth. So magnesium L-threonate, taurine. So there are things that we know that help brain cells regenerate that we can be actively taking and doing. But find that study. Just go to Google Advanced Search and type in UCLA and Alzheimer's, and that study will pop up, and they'll have a list of things that they did from, I think they used a water squirting device. We won't do any brand name calls here, for cleaning the gums, because you get a lot of bacteria through your gums, and these bacteria affect us. Changing the gut biome is huge for any progressive disease. So how many people in here have ever had a course of antibiotics? Maybe I should do it reverse. Who hasn't had a course of antibiotics? 1, 2 people held up their hands, okay? 3. So most of us have had antibiotics, so most of us have a damaged gut biome, and it can literally take your gut biome years to recover, if ever. So it's the brain-gut connection, and those bacteria are giving us healthy products if they're good bacteria. And so they affect the outcome up here, what's happening down here. How do you get those? Probiotics is a great way to get them, but you need to maintain them. So how do you maintain those healthy bacteria? Or am I going to take a probiotic every day the rest of my life? No. So how do you maintain them? You've got that tree to sprout. Now how do you get it to grow up? It's the fertilizer. It's the soil. The soil that our bacteria grow in is called food. That's your fertilizer. That's the soil that your bacteria is growing in. So you want to give it good fertilizer. So vegetables. I have to be a proponent of nuts, low glycemic index fruits. So you want to feed your bacteria, because we're a parasite on our bacteria. They outnumber us 10 to 1, so you want lots of healthy bacteria there, and you want to give them good fertilizer. So choose carefully what fertilizer you give them. Next question. Yes, ma'am. Wait on the microphone, please. Thank you.
In many cultures, women eat the placenta after birth, and I've heard that it's very healthy and gives them renewed energy and what they need, replenishes them. Your thoughts, please?
I grew up on a farm, and the cows ate the placenta after they delivered, and the horses, cats. So that's not unique to the animal. That's not unique to one species of the animal kingdom. I think I would have a tough time getting it down. But if you want to cook and fry it up, or whatever you want to saute that and eat it, it's full of nutrients, lots of iron, which you need to be replenished. So one trick when you have the microphone in your hand, young man, is never give up the microphone. You hold it, and that way someone else doesn't have possession of your microphone. Yes, ma'am, your next question.
Just sharing, my daughter-in-law actually did it, and she is so healthy. She's vegan. She gets cheese because that's the only animal product that she eats. Anyway, okay.
Thank you. Pick someone.
Hi. It's me again, Linda.
Hey, Linda.
Remarkable. I've been doing stem cells for many years. My father was saved in Tijuana, Mexico with stem cells for his pancreas, liver, bone, everything. I've gotten them injected into my body. I've also gotten IV therapy for it. I'm not anxious to go back to Mexico for various reasons. The last time they took fat biopsy from my stomach, I still have a scar. It was barbaric. They cut open my stomach.
Oh, my.
Not deeply, but scraped around. But I'm really interested in this. It's phenomenal what you're brilliant, actually, this laser and stem cells together and working with the patients. I'm looking to do stem cells again. It's time for me to do my thing again. Are you doing this at your clinic? Can I come to your clinic or come to see you to get this?
I only see patients in their homes.
I saw that.
That way I can do it under privacy. The Supreme Court has protected private practice. and I'm the Minister of Health of the Southern Cherokee Nation. You have to become a member of the tribe.
I'm very aware.
And that way we're doing intertribal so there are ways to try to protect yourself. Although let me say clearly that this process doesn't violate any FDA laws. I mean, hundreds of thousands of times a day, blood is taken out at plasma clinics. They harvest the plasma, give you your cells back. So that you have to do it within 4 hours, take the blood out, and you can give a component back. So that's FDA approved. The laser light that we use, because the magic is in the optics, not the laser, is you can look at it. It doesn't damage anything. So those are approved. So we aren't using anything new here, and we aren't using it in any way that would violate any FDA rules. It's just totally novel and new, and some of the cool things that we're seeing are like near magical.
I think it's amazing that you can do it in San Diego, and I don't have to go to Tijuana, Mexico. How about well, we'll have to talk later. There's places I could do it that's I understand. See, people in the audience don't understand how corrupted our system is, and you have to really be under the radar, because they'll come after you at any time they want, because that's who they are, because we're posing a threat. And, you know, you're just, everyone's touching here on it, but I know exactly, because I've had my doctor that I go to have to, they tried to shut him down, and now he has to do various things to keep them quiet. Like when I've gone there, we put a chemo room. We put these things on, and we have to be lay low in our rooms, because God forbid they shut him down. I've seen them kill doctors. And years ago, we had an amazing doctor in Mexico, about 30 years ago, who was doing great treatments. And what did they do? They gave him a couple of $1 million to buy the drug, and of course the drug was never used. They just did that to shut him up and confiscate the drug, because if there's a cure for cancer, there'll never be one. And and everyone in this audience, please don't, and tell your friends not to give to the American Cancer Society. They are the biggest crooks alive. Thank you.
Thank you for your comments. And indeed, so there's nothing illegal about doing the stem cells. I still try to choose, like you say, to try to fly under the radar. I have been attacked by the medical system myself severely, so I totally comprehend that. Next question. Yeah, this lady. Hi.
Hello. Thank you so much. I've learned so much about you, and it's nice to hear all the facts. I have a store called The Waterwell in Huntington, and I'm affiliated with Northport Wellness Center, and they do mammographies, which cost about $300 to $600.
Thermographies or mammographies?
Thermography.
Thermographies. Okay, cool.
Thermographies, yeah. I also had a thermography in 2012, September, which showed that I didn't have anything. And then in February, I discovered my own little bump. So it's really important to have somebody reading them correctly, because otherwise you're in trouble. And I was wondering, with the diagram that you had up there of the thermographies, and they consecutively got better, what treatment did they use?
That particular patient was back the truck up and unload on. This lady was from Moscow. She had this huge fungating cancer coming out of her breast. She was getting insulin potentiated therapy with low-dose chemo. She was getting extreme liquid green diet administered by Dr. Robert O. Young, who has been extremely persecuted by the system. She was getting daily colonics with chlorophyll and salts put back in. She was getting daily massage. I think that's about it. So she was getting multiple modalities. But that was a dramatically beautiful case, which happened to be documented on almost a weekly basis. It's a beautiful study. And so, I only use thermography in relationship to ultrasound, because it should be, because every test has a false negative rate. And so for thermography, that's 10 to 20%, much better than mammograms, which are 48% for women under 50. But you always want to get the best outcome. So I send all my clients, especially a lady with breast cancer, I have them imaged at Universal Medical Imaging with Dr. Galina Migalko. They're in Los Angeles, because she's a doctor doing the ultrasound. I've never quite figured this out. In all the rest of the world, doctors do ultrasound. But in America, a technician does it and then sends a black and white image to the doctor to interpret. And why do you think that is? Money. So we can have a technician doing it, and the doctor, okay, anyway, don't get me started on that. So she's a physician that does ultrasound and thermography and can look at them side by side. And so you want the backup test. You want a test of anatomy as well as the thermography, because your breasts are important, and we want to keep them on your chest and not in the pathology laboratory. Next question. Yes, sir.
Do you have some experience about soft lasers that they can heal tissue and which bringing biophotons in the cell?
What was the key word?
Soft laser. That they
A
can
sub-laser?
soft laser, yes.
Soft laser.
Yeah.
Soft lasers. Yeah. Lasers, energy. Anytime you can produce heat down in a tumor, you're going to increase its death rate. Tumors can't speed up. Remember, they're stuck on the Emenhoff-Meyer pathway, the lactic acid cycle. So they're about 6% efficient. Out of the same carbon chain of food, they only get about 6% of the energy that a normal, using oxygen, the cell would. And so they can't speed up. They can't increase their metabolic rate. And so you heat them up, and they just toast. They burn up because they can't speed up their metabolic processes to go faster. So heat is deadly to tumors. Any way you can get heat down in there or light, it's a good thing. And frequency, everything in the universe is ultimately a frequency. Rife used frequency to cure cancer. Of course, we know what happened to Dr. Rife. And I was trying to find, Reed Winnick is a dentist here in New York that does the thermograms. W-I-N-I-C-K, I think. Reed, W-I-N-I-C-K, dentist here that he has a thermography department. A dentist, it's great for dentists. They can detect inflammation in the gums and infection that you can't see. So again, thank you so much. I'm out of time. You've been an awesome audience, and thank you.